Kriya Kala. Why it is called Kriya Kala or Kala Kriya? Which is correct? Whether you are knowing the name of that meaning of the name Kriya Kala. Okay, stages. I am asking Kriya Kala. Whether any importance is there in that naming? Yes or no? Kriya means that's the thing. Kriya Kala. One Kriya for one Kala. Clear or not? One Kriya for one Kala. Kriya in Sthana Samsraya should not be done in Chayavastha. That's the thing Acharya is mentioning there. He is mentioning this point in Vrana itself. If you are giving a best example, if it is in the Shobhavastha of Vrana, it should not be given in the Vranavastha of Vrana. You're getting or not? Both are extremely different. Isn't it or not? It is called a dam concept of Ayurveda. You are knowing dam. Dam concept of Ayurveda. Okay. Sanjaya, please think that it is a dam. Sanjaya, increase in water level up to normal water level. For example, if a dam is having maximum capacity and increase in the water level just above the maximum capacity is called Sanjaya. Prakopa, a little bit, maximum capacity ke upar. Okay. Prasara, maximum means oozing will be there. Okay. Sthana Samsraya, overflowing. We are not opening the dams. We are not doing any treatment. Then Vyakti, what happens? It is overflowing. Those people who are nearby the river will be affected. So whenever our house is in problematic condition, what will we do? We will we will purchase a motor and we will drift the water out. Or we want to escape. What is the condition there? We want to escape, isn't it or not? That Acharya is telling. Okay. Veda, flooding. Flooding time, everyone is staying in the house. It is not good. For each and every Kriya, there is a Kala. Okay, so for each and every Kala, there is a Kriya. You want to do the same Kriya at the same time. Panchakarma is not the treatment for all the diseases. Rakta Mokshana is not the treatment. That Acharya is conveying this meaning. Clear or not? By that Avastha, Acharya is explaining, Acharya is giving that concept. Okay, all these are treatment concepts. Don't think all these are theoretical concepts. All these are clinical concepts. We are not taking it as clinically. And in Susruda, there are two types of sadhyada. Have you studied this? Snehadi sadhya and Shastradi sadhya. Snehadi should be treated by Snehadi karma itself. And Shastradi can be treated with Snehadi and Shastradi. Don't go for Shastradi for all the time. Patient will be gone. Okay. And expense is more at that time. Now I don't know. For me. So Snehadi should be treated with Snehadi karma itself. Vyadi Samuddesha. It is this concept is for that. Susuda is not telling like a sloga. All these are having inner meaning in that. Simple meaning in that. We want to get that meaning. Kriya, Kala. Kala, each Kriya, Kala for each Kriya. That's all. Clear. Shastradi, you can do Snehadi. If it is not curable, go for Shastradi. Clear or not? Clear or not? Rahul sir? I think eczema, a detailed description is there. I can complete or we want to have, whether it is okay for you, everyone, the class, you can tell from your own aspects. We can complete the eczema, isn't it? So you are knowing, okay, eczema. Okay, we have studied. Why it is called eczema? Anyone? Why it is called eczema? Greek word boiling, bubbles due to tiny vesicles or bubbles seen in the acute stage. It is also called dermatitis. Some are mistaking the diabetes type of dermatitis. Why? Because it is having inflammation of the skin. That's called dermatitis. Itis means inflammation. Derma means skin. So this is the sequence. First of all, it will be vesicle formation. Then weeping will be there. Then crust formation will be there. Then lichenification. This is the formation of eczema. And there are different classification of eczema. I'm giving this PPT to you. You can have. But basically, eczema is divided into two. Endogenous eczema and exogenous eczema. Okay, you're getting. Endogenous means, what is endogenous? Internal factors, a chronic inflammatory skin disorders characterized by pruritus, which is starting in the childhood, but mostly exact causes unknown. Genetic disorders are there. but the family is having history of allergy. That's all. Atopic means we can't know the correct. It is called due to endogenous factors. But second type, exogenous eczema. What is exogenous? From external factors. And there are two types. What is the two types? First one is some irritants will be causing. Basically, some irritation will be causing by some irritants or allergens. Clear or not? This is the point that I want to convey. Clear or not? Endogenous eczema and exogenous eczema. Exogenous means outside. Okay, external factors. So either mostly irritant or some allergens. Endogenous, I think you are knowing, but for me, I'm just telling. And the characteristic features you can check. And this is the reason. Endogenous means from inside. Endogenous eczema, which is otherwise called atopic dermatitis. Atopic dermatitis. From outside, it is called contact dermatitis. It is due to allergens or due to irritants from outside. It is called exogenous eczema. Clear or not? Clear or not? Then absence of a margin. Okay. Sharp margin is a particular important feature that separates eczema from papilloscamous eruptions. You can see that's like papules, or you're knowing that psoriasis, all those types. Sharp margin is not there here. Okay. That is called eczema. Characteristic feature is the absence of a sharp margin. And there are two types according to chronicity: acute eczema, chronic eczema. Acute, it will be weeping, crusting, blistering, redness, papules. And chronic, it will be vesicular, exudative, oozing. Okay, not oozing, scaly, pigmented, and thickened. Clear? I will give this PPT. It is there. And this is acute, vesicular. Vesicles can be seen. Acute case of contact eczema. Okay, I will tell what is contact. It is crusted vesicular contact eczema. Clear? Acute and okay, chronic. This is excoriation, fissuring. Okay, weeping. What is weeping? Oozing will be coming. It is called weeping or wetness. We have studied Sikta Vicharjika and Doksha Vicharjika. Now it is clear for you. Crusting, everything is there. Clear? Lichenification. No margin are there. Clear or not? That's a typical feature. No sharp margin, basically. Okay, you can see the complications and moving forward. So how will you differentiate from psoriasis or lichen planus? What is the main reason? Basically, psoriasis or lichen planus are sharply defined and no signs of epidermal disruption. If you are checking for the epidermis or tissue, you can see that epidermal disruption was not there. Okay, scaly, poorly defined margin. Eczema are having mostly poorly defined margin. And weeping, crust, excoriation, fissures, and yellowish color, basically, are mostly seen in eczema. Clear? Weeping, crust, excoriation, fissures, and yellowish scales are mostly seen in this type. Clear? And eczema is almost asymmetrical. Okay, asymmetrical. And we can see the different types. From that you can identify. And exogenous, endogenous. Exogenous investigation, it is patch test. Okay, patch testing. Okay, standardized non-irritating concentration of any allergens are applied to the skin. I think sometimes you are also giving the same test for a patient with eczema. A patient is coming and telling that I am having contact dermatitis, so you will check for this irritants. Okay, it is called patch test. Photo patch test is a chemical is applied to the skin for 24 hours, then the site is irradiated with suberythromal dose of UV radiation. And you will check for any reaction after 48 hours. It is called photo patch test. It is for exogenous eczema. And for atopic eczema, prick test. Okay, prick test. But it is not only the confirmatory test. You can also go for IgE antibody or a RAS test, radio allergosorbent test you can go for. Or cultures of sometimes bacterial or candida. Eczema is worsening. Check for bacterial and candida infections. Clear? Any having any problem? Endogenous, exogenous. Clear or not? You're fed up with the points or not? I think 2 hours. I'm just asking a little bit with the types. That's all. Eczema is over. So common patterns, the first pattern is irritant contact. It is an exogenous eczema. I have mentioned that there are two types of exogenous, which is contact dermatitis, otherwise called contact dermatitis, which is of irritant and allergens. Irritant is the most common exogenous eczema, 80% of the cases. Okay, strong irritants due to acute reaction. Okay, of prolonged exposure sometimes, and weak irritants are also there. Most of the irritants, can you name some of the irritants? Detergents are there, alkalis are there, solvents are there, some oils, abrasive dust can also cause this irritation. The patient is telling to you, you are knowing all these cases. Clear? And if atopic dermatitis, unknown thing is there, history is there, it will make problem. Clear? Yes or no? It is due to type 4 hypersensitivity. Mechanism is telling us. Second type is allergic contact dermatitis. The first one is irritant. Okay, I am telling the first one is irritant contact dermatitis. Okay, clear or not? Irritant contact dermatitis. Detergents, alkalis, solvents, cutting oils, abrasive dust, all these are irritants. Strong irritants or weak irritants due to acute exposure or prolonged exposure will cause contact dermatitis, skin lesions. Clear? It is called exogenous eczema, the first type. Okay, hard to differentiate from allergic contact dermatitis, second type. But patch test with irritants is almost not helpful, but you can identify the exposure if the prolonged exposure can identify. Clear? Second type is allergic contact dermatitis. It is due to hypersensitivity. Allergens are there. The patient is having some allergy. Okay, after allergy has been established, all area of skin will react to the allergen. Okay, it is specific to one chemical or its close components. One chemical will be having a problem with you and it will cause allergic reactions. Clear? Example, see the areas involved. Eyelids, external auditory meatus, hands or feet, gravitational ulcers. Okay, all these are getting. Some are having problem with hairdressing, working in a flower shop or dentistry will also cause this allergens. Patch test. Okay, it is important. Mainly nickel top is having this problem. Nickel allergy is having this problem. I will tell. Okay, contact eczema caused by allergy to nickel. You can see in which part it is having nickel. What is that allergy? Where is that nickel? Yes. Belt. It is only on belt. Yeah, sib. इसके अलावा this thing. Okay. It is there. Nickel is there. Yeah, button and sib. Yeah. Clear? Contact allergy to nickel. This is dry fissured eczema of fingertip caused by handling garlic. Garlic. Okay. You're getting contact dermatitis. The next one is occupational dermatitis. Second most common is occupational dermatitis. Here hands are most commonly affected. It is also due to irritant or allergic. Okay. Often several factors are there. Chronic hand eczema. Okay. Dermatitis. You are knowing contact dermatitis of hands. Clear or not? The contact type or irritant type or allergic type. Yes or no? You're getting idea. Don't want the full idea? A little bit. I think you are getting clear. Next is atopic. What is atopic? What is atopic? Atopos without a place. We can't tell. Oh, whenever you are asking where you are, I don't know. It is somewhat like that. Atopy, a state in which an exurban production of IgE occurs as a response to common environmental allergens. We can't tell. It is clear what is the reason. May or may not develop. But there is a problem is there. They are having so many other features. Asthma is there, hay fever is there, eczema is there, food allergy. They are having other allergies also. Clear? But we can't tell it is due to this reason that they are having this. It is called ectopic eczema. And mostly these persons are having familial history. My father is having allergy to this. Though I am not having basically, but I am having allergy, but I am having food allergy, asthma, hay fever. Together with this, I am having skin lesions. We can't correct it correctly. It is more often from the mother than the father. If your mother is having something like that, child is having 75 chance of having ectopic eczema. Okay, and it is due to filaggrin gene which is causing ichthyosis vulgaris. Okay, it is having also ectopic eczema. If your father mother is having ichthyosis, you will have surely atopic eczema, 75%. Clear? At least it affects only 3% of infants. 75% of the cases begin before the age of 6 months, and 80 or 90% before the age of 5 years. Please listen, this is very important. Atopic eczema, 6 months. It is before the 6 months. 75% of the cases are starting before 6 months. 90% cases before 5 years. So you can identify ectopic eczema. Clear? And these are the areas in infancy, mostly napkin rash. Clear? Or in the face. In childhood, elbow, knee flexures, wrist and ankles. It is seen as reverse pattern in elbow, knee and wrist and ankles. In adults, it is towards low grade involvement of trunk, face and hands. You can see the areas. Mostly in infants, it is napkin rash. Okay, older child, it will be elbow, knee flexures, ankles. And in grown males, it is seen everywhere. Low grade eczema, basically low grade, lower extremities. You can see atopic eczema in the face, around the eyes. Okay, chronic excoriated atopic eczema behind the knees. Okay, you can also see some cases like this. A line is going, isn't it? Whenever you are marking, that has led to striking white dermographism. It is also a type of okay eczema. When you are scratching, it is coming like this. Clear? Itching. Okay, it can remit spontaneously. I am having so many cases, so many problems are there. Isn't it or not? How many of you are treating? Basically, this is the clinical diagnosis. A chronically itchy skin is a characteristic feature. Plus, history of itchiness in skin. Okay, and the elbows, behind the knees, front of ankles, or history of asthma or hay fever, or general dry skin in the past year, or onset in the first years of life, or visible flexural eczema. This is the characteristic feature of ectopic eczema. Clear or not? IgE level, please check for IgE level. Okay, facial eczema in a young boy. Clear? I'm just moving. Seborrheic eczema. What is seborrheic eczema? Mainly affecting hairy areas or the presence of sebaceous gland. Okay, greasy yellowish scales. Clear? Dry scaly petaloid lesions. PC. Overgrowth of pterosporum E skin commensals. Plays an important role. These are the areas in which seborrheic dermatitis eczema is causing. Axilla, submammary, axilla, groin, around the wings of nose. I will show the photos. Here, you can see this is seborrheic eczema. Dry scaly seborrheic eczema of the ear. Okay, pre-external patch of seborrheic eczema. You can see. Okay, acute seborrheic eczema of the face. Infantile seborrheic eczema of the axilla. Clear or not? At least you can identify that. Yes or no? Candida infection is also common with this. I think you are getting an idea. Okay, discoid or nodular eczema. I have explained. Okay, discoid nodular type. Vesicular weeping patch of discoid eczema. And sometimes this is another lesion, extra form follics. Okay, provoked by heat or emotional upsets or small amounts of nickel in food or allergic to nickel. And this is the eruption. Why it is called form for follics? Eruption of the hands can follow acute tinea pedis. Hence it is called form follics. These are the form follics vesicles. And sometimes gravitational eczema. I think you have seen static eczema, which is seen in patients in this area. Okay, with associated sometimes with swelling, gravitational eczema. Okay. Then steatotic means old age patients having a dry skin and tendency to chap. The removal of surface lipids by overwashing. It is called steatotic eczema. Fine fissures are there in stratum corneum. Clear? And localized neurodermatitis. It is also a type of lichen simplex. Okay. Palmar lichen simplex. Fissured eczema. Hyperkeratotic fissured eczema. And some are having this, yeah, you have seen these patients, juvenile plantar dermatosis, dry skin over the palms and soles. Okay, with subsequent sweat gland blockage. There is no sweating, subsequent sweat gland blockage. And it is also called toxic shock syndrome. And this one you are seeing, napkin or diaper rash or eczema caused by napkin rash. I think ahi, it is called ahi budana, isn't it? Budaguttagam. Clear? And all these are basically pitta predominant lesions. According to our concept, it can be pitta predominant lesions. We can treat it with our triad itself. It is very much effective, but diet is having a very good role. And external and internal environmental factors, irritants, and also having a good role in the treatment of eczema. Clear? So you want to know a knowledge of modern aspect of the disease. Like in planners, it is coming, but I think it is now 9:30. So if you're having any doubt till this portion, you can ask. Whether you're okay with the class, you're getting something from the class. Rahul Doctor, whether we want to conclude, I think Patya is there. One more case, two lichen planus simplex is there.
Yes,
What
sir.
we want to do.
If required,
Hello.
hello, sir. If required, we can do one more session. We can take the feedback from participants as well. No issue in that.
Okay.
It's almost 9:30 and participants are also decreased. Let us see.
Okay. Next session. Okay.
Yeah.
I'm asking whether it is there. One Patya session is there. Two more cases are there. Lichen planus, simplex chronicus, and lichen planus is there.
Yeah.
Okay. So you're getting something from this class that I want to. You can tell the feedback, no problem, directly. Whether this mode is okay for you. You're getting.
Yes, sir. Yes, sir. Yes, sir.
Okay.
We are getting good response from the participants as well. It is really a good session. Dr. Gobika?
Yes, Dr. Rahul.
Yeah. Sir, I think we can conclude for today. Dr. Gobika, please. And we'll continue if one more session is required.
Okay.
One more, you can ask your questions in the chat box or in your to Rahul Doctor, so we can address all the questions in the last session also. You can give your questions, okay, all the questions, so we can address all those things.
Yeah.
You are
Sure.
having.
I think discussion session we can plan for the next session. It's already 9:30. Is it okay?
Yes.
Okay.
Yes, I am telling like that. Okay. You can ask the questions to Rahul Doctor. We can address all those in the next session also.
Okay, sir. Thank you so much, sir. It was very informative session and it is a very thought-provoking for the doctors. You included very rare conditions also and included basic concepts, basic principles in Ayurveda like doshas, koshta. All these are you incorporated in the session. And we have a product presentation now. Now I would like to invite Dr. Rahul for the product presentation. Dr. Rahul.
Yeah. Thank you, doctor. Thank you, sir. On behalf of Kerala Ayurveda Limited, it was really a wonderful session as always, and we will do one more session definitely. And meanwhile, I am requesting all the participants to put your feedback regarding the session in group or in the link which we have already provided. And I'm just entering to my part of responsibility. Kerala Ayurveda Limited is conducting this event as a part of our 80th year celebration. And we have started our operations in 1945 by Vaidyan KGK Panikkar. And in 1948, we started Marunapura. And also in 1975, we incorporated as Kerala Pharmacy Limited. And in 1994, we launched very beautiful patented brands like Glymin, Biogest, Rasna Guglu, Tusnil, Myaxil, Liposum, Iogen, Histandin, and a few more products. Most of the brands most of the doctors are already using. And in 2001, we received a GMP certification for our factory as well. We have a legacy of 80 years and also have a robust portfolio of over 300 classical formulations and over 100 plus patent formulations. And we are the first Ayurveda company to manufacture a patent product in Kerala. And also we are the innovators of revolutionary Gridam capsulization. And the first product was GT capsule. And also we are the first Indian company to secure a US patent for a unique herbal Ayurvedic combination. We have received a US patent for our product Ketan, and it will be launched in the market soon. And also, we are always steadfast in preserving the heritage of Kerala Ayurveda through our brand Kerala Ayurveda. And I would like to introduce few of our brands. The first, I would like to start with the classical category. Already, sir has mentioned few of the brands, and we are manufacturing these brands: Manjishtadi Kwat, Mahamanjishtadi Kwat, Guluchiadi, Mahatiktagam, Tiktagam, and Aragudadi Kwat. That will definitely help in your practice. I am just introducing the product name of classical category, not going detail. And also we have Rasuttamadi Lebam, Khadirarishtam, Villuadi Guliga, Kaishora Gugulu, and also oils like Eladi Keram, Chambaratiadi, Nalpamaradi, and also Durdurapatradi, etc. And I would like to start with our patented brands, that is Vinsoria oil. It is a beautiful combination which is containing Vidpala or Dandapala or Shweta Kudaja, along with the Manjishta and Shariba in Kera Thailam base. It is for external application. Helps to relieve itching and also soothes the skin inflammation, reduces scaling and pigmentation, and also helps to restore the skin tone, promotes skin regeneration, and also minimizes the reoccurrence. And indications are psoriasis, eczema, and also can be used logically in dandruff as well, along with mixing with the coconut oil. And next is Mahatiktaka Gridam in soft gel capsule form. You all know the use of Mahatiktaka Gridam. And we made it into a form of a soft gel capsule in 3 avarti. And all capsule, each capsule is almost equal to 2.5 ml of Gridam. If you required 5 ml of Gridam, 2 capsule is enough for the patient. And the classical indications of Mahatikta Gridam is, as you all know, Kushta Visarpa, Vrana, Grandi, Grahani, Amla Pitta, and Pandu. And practically in eczema, carbuncles, pruritus, chronic ulcers, and fistula in ano, we can use this combination. And next is GT capsule. As I mentioned, this was the first Gridam in soft gel capsule form, Guglu Tikta Gridam. It is in fortified form. We know the taste of Guglu Tikta Gridam. The most of the patients are not ready to consume Gridam because of its palatability issues, and we made it into the form of a soft gel capsule. Here you can see the Sanskrit words of Nimba Guglu Tikta. I'm not going detail into that. And it is also a 3 avarti Gridam capsule, and each capsule is equal to 2.5 ml of Gridam. And the classical textual indications are Vada Roga, Kushta, Nadi Vrana, Arbuda, Bagandhara, Gandamala, Jatrudha Sarvagada Roga, and Gulma, Meha, Aruji, Penasa, Kasa, Shofa, Hridroga, Pandu, Vidradi, Vadarakta, and Yakshma are explained in textual indications. And practically, we are using this combination in chronic inflammatory and non-inflammatory arthritis, chronic degenerative joint or bone disorders, osteoporosis, chronic RA, chronic gout, chronic and deep-rooted skin disorders, psoriasis, eczema, allergic dermatitis, fungal infections, piles, fistula in ano fissure, obesity, hyperlipidemia, hypercholesterolemia, diabetic complications, metabolic dysfunctions, chronic non-healing wounds, necrotic ulcers, venous ulcers, and varicose ulcers. And there are many other practical conditions as well for this beautiful formula. And next is Histandin tablet. This formula we launched in 1994 along with our other patent brands. It is an effective remedy for dermatitis, pruritus, and urticaria. Helps to develop adaptive immunity power against allergens. It's a non-habit forming, non-steroidal, anti-allergic formula. And next is a cosmetic product, that is Swarnamukhi face cream. It's a unique blend of Kanaga Thailam with Lodra, Priyangu, and Kunkuma. And it has both oil and water-based cream. And And also, I'm getting many queries regarding the recording and also the support regarding our product availability in various regions. For any assistance regarding our products and services, you can contact my number 8281862723. I will repeat 8281862723, and also you can send a mail to my mail ID drrahul@keralaayurveda.biz. And that is the end of my presentation. Thank you all for patient listening, and over to Dr. Gobigas. Once again, thank you all for participating, and Aravind sir for your wonderful session. Dr. Gobiga.
Thank you, Dr. Rahul. Okay, thank you, Dr. Rahul. And as we are planning for discussion session in the upcoming sessions, we are running short of time. So I would like to convey our sincere thanks to Dr. Aravindas for the dedicated efforts for a wonderful presentation with a clear presentation skill, sir. And once again, I'm thanking all the participants for their active participation during the entire session, and we looking forward for your presence in the upcoming sessions also. Okay, once again, I'm conveying our thanks to everyone, and I would like to appreciate that all the concepts are included in the presentation. Thank you once again. Thank you, sir. And thank you. Good night.